Wear the Gown is sponsored by CHI St. Vincent.
One of the repercussions of the COVID-19 siege is that we're not going in to see our doctors. And there has been an explosion now, because of that, of telemedicine. And in our continuing series of Wear the Gown, family physician Dr. Keith Cooper of CHI St. Vincent agrees telemedicine has arrived.
We had been investigating this as a possible modality to see our patients, but it really wasn't until out of this crisis we really pushed along, and within just a week or so we're able to sort of perfect this technology, and out of necessity came this technology. So that's been really nice. Probably more than treating the coronavirus, we've been treating a lot of anxiety related to this, and that really lends itself well to a nice face-to-face discussion with someone that to be able to put people's mind at ease that we're still here for them. We're reaching out through telemedicine and can still help.
What things do you want to know? What should a patient be prepared to share with you on telemedicine?
That's a great question. The limitation is we're not physically there with them, so we can't lay hands and look in ears and eyes and listen to hearts. And so we really need a lot of information from the patient about their symptoms, particularly these days if they have a thermometer at home to be able to check their temperature. It's helpful if they have their own blood pressure cuff. That way they can share some vital signs with us. And then just to be patient with our questions, and sometimes also flexible to take the phone and move it around their body and show us certain things if we need some help there.
What are the chances you will have to come back and see you eventually? Telemedicine can only go so far, right?
That's right. And really some of the rules of telemedicine are that you're really supposed to already be established with that physician's practice to be able to initiate telemedicine. It would be difficult to take on a brand new patient that we had never actually seen.
What advice would you give people about telemedicine? What would you tell them?
I would say if you don't feel like you're tech savvy enough yet, then have a grandkid, get your phone hooked up, and don't be afraid of it. It's just like talking to a friend, and we found it to be very casual and reassuring. And that's the biggest thing, is it's not overwhelming technology, especially when what the COVID has allowed us to do with these new technologies.
And according to Dr. Cooper, you schedule these telemedicine sessions just like you would a regular appointment, by going through their receptionist or the person in charge of appointments at the doctor's office. And he said they average about 10 minutes.